Hey there, this is Dr. Tall Paul Simon, psychiatrist. Please subscribe to this channel for mental health tips from a common sense psychiatrist perspective. This video is a little bit about parenting. First of all, I gotta say, we have 4 kids. We have 3 teenagers right now and a 12-year-old. 2 are driving, 1 has a job, and they're getting ready for college. So while they haven't made it all the way into adulthood, I am speaking from personal experience, okay? So far, we're doing pretty good. Um, I can speak from some personal experience and professional as well. So I treat adolescents and adults. So I see a lot of adolescents and kids who have some pretty severe mental health issues, but also run-of-the-mill anxiety and depression, ADHD, and things like that. Now, younger kids than that are not my forte per se, but I can speak to some of those situations. So first of all, what kind of problems arise in kids? Anger, mood swings, defiance, behavioral problems, right? So a couple main key concepts to remember in approaching a situation like that. So you have to look at the family, number one, because a kid does not have much control over their environment. They really not all the time, but to some degree, they are always a reflection of their environment. So if there's a lot of anger in the household and chaos and disrespect and name calling and all these kind of things in the environment, they're naturally going to reflect some of that. Now, they may display it in different ways that grab more attention, but usually if the kid is having some problems, there's some problems in the family. Now, I can speak from my personal experience and professional experience that no family is perfect. So there's always things that need to be worked on. If, let's say, a kid is brought in by their parents, the first thing I always look at is their family environment. Now, that being said, how do you address that? Well, if, let's say, you are looking or considering treating a kid with medication, like putting a chemical in a kid's body and brain, I think it's reasonable to ask the parents, even if you're not seeing obvious signs of problems, to go to a family therapist or having some kind of evaluation on a family level. Because if the kid is expected to take a medication and risk their physical health, I think it's reasonable to ask that time and effort of the family itself, the parents especially, to put in the time for family therapy. So there are parenting classes, seminars. Pediatricians are a really good resource for that kind of thing as well. Psychologists and counselors are great. Now, not all of them do family therapy. That's one difficulty, and a lot of that depends on insurance, reimbursement rates and things. Now, one thing about family therapy is that it does not mean that the entire family gets in a room and hashes it out all at once. That is not how it works, okay? So the counselor, whoever is doing the family therapy, wants to understand what's going on in the family and then kind of divide and conquer. So if, let's say, the parents aren't getting along, for instance, or they're not on the same page with discipline and other things, okay, that's where they might start. Or if there's an older kid that is stirring the pot and is causing problems, okay, let's maybe work on the parents in that relationship. Even if the family therapy doesn't directly involve the child that is the identified problem, working on the whole system in that environment can really make a difference. It really is key, because sometimes the kids reflect their environment, right? We all do. If there's a lot of anger and chaos in an environment, we're going to feel that one way or the other. So another important concept relating to that is, let's say when a kid is really upset and throwing a tantrum, let's say, or violent aggression, or all these extremes of emotion, one thing is to really focus on your own emotional state, okay? So if you find yourself losing control of your emotion as a parent, then you're in a place that you're not able to help that kid effectively, okay, or guide that kid. So the kid is always going to just naturally, instinctively mimic our behavior to some degree. So if you're yelling and more angry than the kid is, okay, then that's a problem. All right. So you always have to start with yourself in any interaction. I've had instances where I've worked in the emergency room where there have been extremely agitated, psychotic, large adult males who are just out of control. And I've found the key in even those extreme instances is that if I am rising to their level of angst and anger and upset and fear, then it just adds fuel to the fire. Now, if I can show them just by example, being calm and collected and rational and caring, then they tend to follow that. They tend to latch on to that example because they are looking for calmness and stability and safety and reassurance. So if we can provide that to them, they often will come down to some degree. Now, depending on the situation, things may or may not work very well, but sometimes medications are required in extreme circumstances. But Parenting 101, always look at your own situation internally first, okay, and start there. All right, it's hard to do. It's hard to do. Humbling, but if we can start with ourselves, it'll help, okay? So for other more detailed, specific parenting tips and techniques, please see other videos regarding parenting in this channel, okay? You guys take care, and God bless.